Hello, welcome to this short where we are talking about Toradol, the NSAID that is going to be used for pain management. This is going to be a 15 milligram IV slow push, so around 15 seconds or so. 15 milligrams, 15 seconds, easy to remember. Or an IM injection. You should start to see this taking effect around 10 minutes or so is when it's going to start to work if it's an IV. If it's an IM injection, quite a bit longer, around half hour or so, with peak impact being around 1 to 2 hours. Now notice that is quite a bit slower than we are used to with an opiate, for example, but that does not mean that this cannot provide significant analgesic effect and should totally be considered and done for our patients. Mechanism of action is going to be blocking prostaglandin synthesis, and what this is going to do is a lot of things, but the three things that we're looking for is going to be a reduction in inflammation, reduction in pain, and a reduction in fever for our patients. Specifically though, just for our protocol, we are focused on that pain. But all of these things are going to work in conjunction to help our patient. Some other things that might happen that are maybe non-desired, the list is extensive, but these are kind of the hits, is going to be bleeding, GI irritation, renal impact, renal effects, and bronchospasms. Now, renal effects, that's a little vague. So let's segue into our exclusionary criteria, and we'll start with chronic kidney disease. Why that? So this medication is going to reduce blood flow to the kidneys. So if I have a patient with a kidney injury or chronic renal failure, this is going to be particularly impactful for them, all right? And that's something that we need to keep in mind. Other exclusionary criteria, we have head injury with headaches, trauma with potential spine, head, chest, or abdominal bleeding, chest pain, chronic anticoagulant use, GI bleeds, pregnant patients, we talked about our kidney patients, and pediatrics. All in all, I think this is going to be great for our patients experiencing pain in the pre-hospital. If you guys have any questions about Toradol, just reach out. Thank you for your time.